Coming to alcohol use disorders, it is worthwhile to know that alcohol is consumed in various forms, like, for example, beer, wine, what we refer to as spirits. Okay, so remember one thing, alcohol chemically it is nothing but C2H5OH, that is ethanol. Okay, so we need to know that what are the concentrations that are available in terms of beer. It is about 4 to 8% of alcohol content is there. In wine, up to about 6 to 12% of alcohol. In hard liquors like whiskey, vodka, so they contain about 40% of alcohol in them. And one other variety wherein arak, which is called as country liquor or desi liquor, which contains up to about 30%. And remember, some of the stronger beer they can go up to as high as 8 to 12%, and fortified wine can go up to 15 to 20%. Okay, so one needs to know about this concentration of alcohol because of a clinical significance, that the average amount of alcohol intake will determine the detoxification doses of particular medications. Okay, and one other thing that is important to remember here is what comprises one standard unit or drink. Okay, so roughly it comes to about 330 ml of beer, which is equivalent to 30 ml of spirits, which is equivalent to 125 ml of wine. Okay, this is a one standard unit of alcohol. Coming to blood alcohol concentration, which is important variable which determines the acute effects of alcohol. So we are going to see what are the effects of alcohol based on the concentration in blood. So initially 10 to 20 mg, that is the initial concentration, okay, wherein person has some kind of a disinhibition, kind of a euphoria to start with. This is the one aspect which makes people to go back again and repeat this particular behavior. Okay, then 20 to 30 mg per deciliter is the time when there is some kind of a slowed motor performance will be there, and this is the one wherein you need to know that 30 mg per deciliter is the legal limit for drunken driving, okay, in India. But in UK, so it is around 80 mg per deciliter. Okay, right. So what happens when it goes beyond 30 mg? So this is stage wherein there is some kind of a motor incoordination, impaired thinking, and also reaction time might increase. That's the reason why it is recommended that so one should not drive at this stage. Okay, then 80 to 200 mg per deciliter, this is a stage wherein there will be gross incoordination, and there will be errors in judgment. Okay, so beyond this, that is 200 to 300 mg per deciliter is the period wherein a person has nystagmus, slurring of speech, even sometimes referred to as blackouts. So these are the transient episodes wherein the blood alcohol concentration reaches up to about 200 to 300. The person won't remember, though at that point of time the person is able to carry out complex tasks, both motor or in terms of cognitive tasks, but the person doesn't have a memory to that particular event. Okay, beyond 30 mg per deciliter is the stage wherein person has enters into coma and even subsequently death. Okay, so these are all the acute effects of alcohol. So it's also important to note that what happens to alcohol within our body. Okay, so just to give a brief description about, so alcohol, it gets metabolized into acetaldehyde by action of one enzyme, that is alcohol dehydrogenase. This happens in liver. And the second stage is acetaldehyde gets converted into acetic acid by the action of aldehyde dehydrogenase. Okay, so it's a two-step process wherein alcohol first gets oxidized into acetaldehyde, then acetic acid, and acetic acid is eliminated safely by getting converted into carbon dioxide and water. Remember, alcohol is majorly absorbed in small intestine. Okay, duodenum and jejunum are the parts wherein maximum absorption up to 80% occurs. So maybe about 10% absorption occurs in stomach, and that is the reason why when alcohol is consumed along with the food, it delays the absorption. And also that when there is excess amount of alcohol in stomach, so it causes kind of a pylospasm, and also it can lead on to vomiting, nausea and vomiting. Okay, that's how acute gastritis results.